So, on the occasion of this World Heart Day, we celebrate on every 29th September of each year. The theme of the Heart Day last year was Use Heart for Every Heart. Continuing with the theme, India is one of the highest prevalence of coronary artery disease across the world, and we account for almost 12% of world's cardiovascular burden. This year, we are going to go with the theme Beat the cardiovascular disease by beating the yellow. Yellow means fat deposition in the coronary arteries, that is atherosclerosis. My colleague Dr. Mukesh and me will discuss about how heart disease is prevalent across the world, how is it different in Indian situation, and what are the risk factors and methodology of preventing it. So Dr. Mukesh, what do you feel about the coronary artery disease burden in India?
We are having one of the highest number of heart diseases in the world. Almost 1 in 5 we are having heart disease. And the problem is more young patients. So blowing less number of candles on a birthday doesn't ensure you that you are safe from your heart disease. So everybody has to take care of their heart. So the theme is
Beat the cardiovascular
disease with yellow. Yellow is the fat. So we have to remember that cholesterol is in the form of fat. We have to reduce it. So what do you think the burden, and then what are the risk factors in India?
Yeah. So basically, the burden in India is we get cardiovascular diseases a decade younger than the Western population. The risk factors which are slightly different from the West are our coronary artery size is slightly less than the Western people. The disease is diffuse in nature, and more than 20% of the coronary artery angiograms done reveal chronic total occlusive diseases of the heart. And this has overall increased in the recent 15 to 20 years because of lot of urbanization which has taken place in India, and we have resorted from a healthy village lifestyle where people were agriculturists and doing all their work physically to a urban society where we have become couch potatoes. We started eating lot of junk food and we have a high carbohydrate content in our diet. The incidence of coronary artery disease in the urban population is about 7 to 13% compared to rural, which is 2 to 7%. So now we'll discuss one by one the risk factors. Dr. Mukesh, what do you feel about smoking as a risk factor in coronary artery disease?
Smoking is a very important and dangerous risk factor. So smoking not only causes lung cancer and so many other problems, it causes a lot of blockages in the heart. And even patients with mild blockages, they can have major heart attacks if they continue to smoke. So it is very important to stop smoking and then take care of their healthy lifestyle. So lifestyle is a most underestimated thing. So being healthy, being thin doesn't ensure you that you are healthy. So even thin people have to do regular exercise. That is, the recommended is 30 to 45 minutes of aerobic exercise. Apart from that, eating healthy is very important. So eating healthy means you have to reduce your salt and then increase your fruits content and reduce red meat, fried foods, stored foods, canned foods. They all contains very high amount of cholesterol as well as salt. So we have to eat healthy and then do regular physical activity to reduce your cardiovascular burden. So what about other risk factors, Rajeev? Mainly hypertension, diabetes and other things.
Yeah. So you have very nicely discussed about smoking and importance of exercise in our daily schedule. Nicely mentioned that at least 30 minutes of workout, aerobic exercises 5 times a week is what is necessary. And in smoking, you rightly pointed out that it's a very important risk factor. We have about 12% population smokers in our India, and they precipitate plaque rupture, vasoconstrictive occlusive disease and constrictive disease. Now, other risk factors being high blood pressure. Every 4th Indian after the age of 25 suffers either from hypertension or diabetes. Hypertension is defined as any blood pressure above 140/90 in a normal population, and in aged population, which is nowadays plus 75, about 150/90. Any blood pressure above this is taken as hypertension, and if you are having end organ damage, that is blood pressure and coronary artery disease affect major organs like brain, kidney, heart, and eyes, and peripheral vascular disease like decreased blood supply to the leg. So these are known as target organ damage in cases of patient having risk factors of hypertension, diabetes. All these risk factors, if they are progressively involved in more than 15 to 20 years of disease, you tend to get this target organ damage. Once you have target organ damage, the level of blood pressure at which we call hypertension is slightly reduced. In diabetic nephropathy, that is when kidneys are affected, we call blood pressure when the pressure is more than 130/85, and we should treat it aggressively. Now regarding diabetes, almost every third person after the age of 25 in our country is detected to have diabetes if screened for it. The rationale behind diabetic being a very important risk factor is it causes acceleration of atherosclerosis. That is what the theme of the day is: beat the yellow, beat the cardiovascular disease by beating the yellow. It accelerates the deposition of fat in blood vessels, and the plaque covering, that is fibrous cap over the lipid coat of the arteries, is thinned out, and when it ruptures, clotting occurs over it, and it causes heart attack if it is on the heart. Otherwise, if it is in the leg region, you can get gangrene. In the kidney, you can get kidney failure. In the eye, you get loss of vision. So all these can be prevented by proper diabetic control, which is defined as fasting sugar less than 100, post lunch less than 140, and a HbA1c hovering around 6 to 6.5. So it is mandatory for all of us after the age of 25 to get our sugars regularly checked. And if you are a diabetic, once a year you should get cholesterol and associated cardiovascular tests like echo, ECG, TMT, and your sugars once in 3 months. So that is the general regime what we follow. Now, Dr. Mukesh, after this, what do you say the importance of COVID-19 in our causation of heart disease?
Yeah, COVID-19 has definitely increased the risk of heart attacks because there is increased tendency to form blood clots. So patients who had COVID, subsequently we have seen a lot of patients, young patients coming with heart attacks because COVID per se itself causes a clotting tendency, and we had a lot of heart attacks. So now with COVID out of the picture, now we are returning back to normal. We have to look at our other risk factors like cholesterol, obesity, and stress. Stress also contributed during the period of COVID because of lack of jobs, lack of finances. So stress is an important and unmeasured risk factor. So you can measure your BP, you can measure your cholesterol, sugar, but you cannot measure your stress. So it is very important to individually assess somebody is under stress and then do yoga, meditation that will help in reducing the stress. And apart from that, as Rajeev is mentioning, you have to reduce your cholesterol. So LDL cholesterol, all of us should have a lipid profile test done, and you have to look at your good cholesterol and bad cholesterol. Good cholesterol is the HDL, and rest of all are bad cholesterol. So there will be numbers written, but what we generally recommend is after you get a lipid profile test, go and meet a physician. So as per the other risk factors, they fix up what are your target LDL and HDL and triglycerides and all those things, and you get treated accordingly. And what about the other things like obesity, which is contributing nowadays,
Yes.
particularly in India, children are more obese.
Yes.
So can you throw some light on that?
Obesity is an important risk factor in causation of cardiovascular diseases. Obesity is a measure in which we measure the body mass index, which is calculated by the formula weight by height in meter square. Average Indian BMI for a female is between 18 to 23, and for male it is between 18 to 24. Anything between about 25 is known as overweight. 25 to 29 comes under the category of overweight. And if your BMI is between 30 to 32, grade 1 obesity, 32 to 35, grade 2 obesity, and 35 and above is grade 3 obesity, that is morbidly obese. And they have to be addressed as importantly as we address diabetes, hypertension. So, as physicians, as responsible people of the society, we should encourage diet and exercise program. By chance we fail in diet and exercise, Orlistat is the only drug which is recommended for reduction of obesity as of now. But if the patient is morbidly obese and unable to reduce weight, we do have an surgical correction of obesity in form of bariatric surgery. So depending on the situation, we can suggest the patient to reduce the weight and try to achieve normal BMI. And these are the most important risk factors what we have discussed. Now, Dr. Mukesh, what is the methodology of correcting these risk factors? How do you propose to control cardiovascular diseases by controlling risk factors?
That is the most important point which we are coming. So it is important that you identify the risk factors early. The biggest problem what we have is we are not able to identify the risk factors early. So it is prudent to screen the people about 20 to identify their risk factors, like check your blood pressure, check your cholesterol, diabetes, and then assess the mental status, the stress, and then try to correct these things. So by identifying early, treating adequately, and following up meticulously, we can reduce this cardiovascular disease to a large extent. Like West, which they started much early, they had a high incidence of coronary artery disease earlier, but now they are normalizing. So now we have to follow the same trend. So we have to take a lot of measures to detect early and then treat early and then control to prevent this cardiovascular disease.
The best thing is, I would leave this message on a important thing to remember, like our phone numbers. You remember your BMI, as I mentioned, it should be less than 25. Then your fasting less than 100 milligram per deciliter, post lunch less than 140, and blood pressure less than 140 by 80. So these are the numbers. As you remember your mobile numbers, remember these numbers, they are very important. Be fit and not fat. Inculcate exercise in your daily schedule, at least 30 minutes 5 times a week, and it will take you a long way to prevent cardiovascular diseases. And if you have one, kindly get it examined and follow up properly with your doctors. Thank you. Happy World Heart Day, and beat the cardiovascular disease by beating the yellow.